So a lot of questions are asked by people around COVID vaccination. Some of the questions, as you saw, we were addressing in this program. But the most basic of those questions, we have Dr. Srivastava, who's still with us. There are some basic questions. For instance, how safe is the vaccine that is available as of this moment? So let's go across to Dr. Srivastava and ask him this. You know, Dr. Srivastava, on Google, one of the most popular searches done by people is on the safety of the vaccine, whether it is safe or not. I want to ask you, what will you tell these people? While most in the urban areas are convinced, they read more, they hear more, there are many people who hesitate largely because of its safety.
Yeah, okay. So that's again a very good question you're asking. If you just look at most of the most recent vaccines in the last 10 years' time, all right, by and large, if you have calculated for the potential adverse reaction of the kind of protein that you're injecting to combat a particular kind of a viral infection, by and large, most vaccines are reasonably safe. Their incidence is in single digits of complications. Some of the complications may be grievous, but otherwise they are by and large pretty simple, pretty safe vaccines, and that they don't have long-term side effects. Now, that may not be the case for every vaccine. And now that we are dealing with the COVID-19 vaccine, which has got multiple mechanisms, there are multiple vector-borne mechanisms, there are messenger RNA mechanisms, there are other frozen mechanisms. So we don't know enough about the vaccines for COVID-19 at this time, and that it may actually be going through processes whereby we'll probably find out that these are the consequences of the vaccine, maybe in who knows, maybe in a couple of years' time, or 3 years or 5 years' time. But if you were to ask a simple question in yes or no, is the vaccine safe at this time? I would have to say yes. Based on the evidence available at this time, it is safe. However, I'd like to draw your attention to some of the vaccines that were developed in the last about 5 years' time in other parts of the world, in parts of Southeast Asia, in Vietnam, in Cambodia, in other parts of Southeast Asia, where it looked like they were going to be very safe. The dengue vaccine, when the first set of information came out, it was supposed to be really safe. In less than about 3 months' time, the side effects of the vaccine came out, and that while it was still going through that phase of its trial, it was decided that it is no longer safe to even continue the trial. So these things happen. It is impossible to say how one mechanism of a vaccine is going to be completely safe or partially unsafe.
No, but then that is why, Dr. Srivastava, you've got agencies like the Drug Controller General, which studies all the data, which scans all the data, and then arrives at a conclusion.
See, all the things that you have just mentioned are evidences on paper, right? When you say that you've got a vaccine that you're giving to a patient who is actually infected, you've got a patient with COVID-19 who's infected, you're giving this vaccine to somebody who's got the COVID-19. That is going to be a very different kettle of fish as to what might be a trial candidate, what might be a person who has volunteered and said, okay, I will take the vaccine, I've got a variant. So vaccines are never given to those people who are acutely and grievously unwell.
Sure.
The person you pick for a trial is somebody who's got the mildest form of the disease.
Let me ask you the next question. Yeah, Dr. Srivastava, there's another question on the effectiveness of the vaccine. Now, suppose if a vaccine is very safe, but if it is not effective, then it's useless, no? So, on the vaccines that are available as of this moment, data clearly shows that they seem to be effective. People who have been vaccinated are not getting infected as much as those who haven't taken the vaccine.
So again, let me draw your attention to something else that we are seeing. So of the 2 vaccines that are available in India for COVID, in one of the vaccines, there appears to be a mechanism that is called the immune escape. That means after the second dose of the vaccine, people are getting COVID. It's not as grievous as it was had you not taken the vaccine, but it is still there, and that it is a different presentation. Right? So how effective is it? Look, all of the data that we're talking about is less than 18 months old. 18 months, to my mind, is not enough time for you to draw your own inferences and conclusions and say, look, I think that this is the evidence that is available. Now, whether you call that the safety or the efficacy or the ability to make antibodies, make neutralizing antibodies, continue to be in a patient system for 3 years or 5 years, we don't know any of these things. And anybody who pretends to say that, yes, we know it, is only a paper tiger who seems to think that this is there because there is some evidence that is present on paper. I'm sorry, I could have said it in a less harsh way, but this is an important
You are
aspect.
entitled to your views, Dr. Srivastava. And very nice of you for having come here and address these issues. But thank you so much. I'm sure you too would encourage people to go out and get vaccinated, wouldn't you?
Yes, I would. Yes, I would encourage them to go out and get vaccinated so that we have even more data about the safety and the efficacy of the vaccine. And I hope that the vaccine is going to be the game changer in a condition like COVID, whether it is the first wave, the second wave. Do remember that the virus is actually changing every 11 days. That is what we know for sure. Every 11 days, there is some genomic transformation of the virus. And what the virus is going to do at the end of 2 years or 3 years, with or without the vaccine, is something we don't know anything about. So I do hope that for the overall safety and the larger good of the general public being safe, I hope that as many people who can take the vaccine will have taken the vaccine in the shortest possible time.
Dr. Srivastava, thank you so much for joining us. With that, we come to an end of this broadcast, but news continues on the other side. Stay with us.